Diabetes mellitus, DM, commonly known as diabetes, is a group of metabolic disorders characterized by a high blood sugar level over a prolonged period of time. 11. Symptoms often include frequent urination, increased thirst, and increased appetite. Though, if left untreated, diabetes can cause many complications. Though, acute complications can include diabetic ketoacidosis, hyperosmolar hypoglycemic state, or death. 13. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, damage to the nerves, damage to the eyes and cognitive impairment. Though, 5. Diabetes is due to either the pancreas not producing enough insulin, or the cells of the body not responding properly to the insulin produced. 12. There are three main types of diabetes mellitus, though. Type 1 diabetes results from the pancreas's failure to produce enough insulin due to loss of beta cells. Though, this form was previously referred to as insulin-dependent diabetes mellitus, IDM, or juvenile diabetes. Though, the loss of beta cells is caused by an autoimmune response. 13. The cause of this autoimmune response is unknown. Though, type 2 diabetes begins with insulin resistance, a condition in which cells fail to respond to insulin properly. Though, as the disease progresses, a lack of insulin may also develop. 14. This form was previously referred to as non-insulin dependent diabetes mellitus, NIDM, or adult onset diabetes. Though, the most common cause is a combination of excessive body weight and insufficient exercise. Though, gestational diabetes is the third main form, and occurs when pregnant women without a previous history of diabetes develop high blood sugar levels. Signs and symptoms. The classic symptoms of untreated diabetes are unintended weight loss, polyuria, increased urination, polydipsia, increased thirst, and polyphagia, increased hunger. 14. Symptoms may develop rapidly, weeks or months, in type 1 diabetes, while they usually develop much more slowly and may be subtle or absent in type 2 diabetes. 25. Several other signs and symptoms can mark the onset of diabetes, although they are not specific to the disease. In addition to the known ones above, they include blurred vision, headache, fatigue, slow healing of cuts, and itchy skin. Prolonged high blood glucose can cause glucose absorption in the lens of the eye, which leads to changes in its shape, resulting in vision changes. Long-term vision loss can also be caused by diabetic retinopathy. A number of skin rashes that can occur in diabetes are collectively known as diabetic dermatomes. 26. Diabetic emergencies. People, usually with type 1 diabetes, may also experience episodes of diabetic ketoacidosis, DKA, a metabolic disturbance characterized by nausea, vomiting and abdominal pain, the smell of acetone on the breath, deep breathing known as small breathing, and in severe cases a decreased level of consciousness. 27. A rare but equally severe possibility is hyperosmolar hypoglycemic state, HHS, which is more common in type 2 diabetes and is mainly the result of dehydration. 28. Treatment-related low blood sugar, hypoglycemia, is common in people with type 1 and also type 2 diabetes depending on the medication being used. Most cases are mild and are not considered medical emergencies. Effects can range from feelings of unease, sweating, trembling, and increased appetite in mild cases to more serious effects such as confusion, changes in behavior such as aggressiveness, seizures, unconsciousness, and, rarely, permanent brain damage or death in severe cases. 28, 29. Rapid breathing, sweating, and cold, pale skin are characteristic of low blood sugar but not definitive. 30. Mild to moderate cases are self-treated by eating or drinking something high in sugar. Severe cases can lead to unconsciousness and must be treated with intravenous glucose or injections with glucagon. Causes. Type 1 Type 1 diabetes is characterized by loss of the insulin-producing beta cells of the pancreatic islets, leading to insulin deficiency. This type can be further classified as immune-mediated or idiopathic. The majority of type 1 diabetes is of the immune-mediated nature, in which a T-cell-mediated autoimmune attack leads to the loss of beta cells and thus insulin. 42. It causes approximately 10% of diabetes mellitus cases in North America and Europe. Most affected people are otherwise healthy and of a healthy weight when onset occurs. Sensitivity and responsiveness to insulin are usually normal, especially in the early stages. Although it has been called juvenile diabetes due to the frequent onset in children, the majority of individuals living with type 1 diabetes are now adults. 6. Brittle diabetes, also known as unstable diabetes or labile diabetes, is a term that was traditionally used to describe the dramatic and recurrent swings in glucose levels, often occurring for no apparent reason in insulin-dependent diabetes. This term, however, has no biologic basis and should not be used. 43. Still, type 1 diabetes can be accompanied by regular and unpredictable high blood sugar levels, and the potential for diabetic ketoacidosis or serious low blood sugar levels. Other complications include an impaired counterregulatory response to low blood sugar, infection, gastroparesis, which leads to erratic absorption of dietary carbohydrates, and endocrinopathies, e.g., Addison's disease. 43. These phenomena are believed to occur no more frequently than in 1% to 2% of persons with type 1 diabetes. Type 1 diabetes is partly inherited, with multiple genes, including certain halogenotypes, known to influence the risk of diabetes. In genetically susceptible people, the onset of diabetes can be triggered by one or more environmental factors, 45, such as a viral infection or diet. Several viruses have been implicated, but to date there is no stringent evidence to support this hypothesis in humans. 45, 46. Among dietary factors, data suggest that gliadin, a protein present in gluten, may play a role in the development of type 1 diabetes, but the mechanism is not fully understood. 47, 48. Type 1 diabetes can occur at any age, and a significant proportion is diagnosed during adulthood. Latent autoimmune diabetes of adults, LADA, is the diagnostic term applied when type 1 diabetes develops in adults. It has a slower onset than the same condition in children. Given this difference, some use the unofficial term type 1.5 diabetes for this condition. Adults with LADA are frequently initially misdiagnosed as having type 2 diabetes, based on age rather than cause. Type 2 diabetes is characterized by insulin resistance, which may be combined with relatively reduced insulin secretion. 12. The defective responsiveness of body tissues to insulin is believed to involve the insulin receptor. However, the specific defects are not known. Diabetes mellitus cases due to a known defect are classified separately. Type 2 diabetes is the most common type of diabetes mellitus. Though many people with type 2 diabetes have evidence of pre-diabetes, impaired fasting glucose and or impaired glucose tolerance, before meeting the criteria for type 2 diabetes. 50. The progression of pre-diabetes to overt type 2 diabetes can be slowed or reversed by lifestyle changes or medications that improve insulin sensitivity or reduce the liver's glucose production. 51. Type 2 diabetes is primarily due to lifestyle factors and genetics. 52. A number of lifestyle factors are known to be important to the development of type 2 diabetes, including obesity, defined by a body mass index of greater than 30, lack of physical activity, poor diet, stress, and urbanization. 38. Excess body fat is associated with these % of cases in people of Chinese and Japanese descent, 60-80% of cases in those of European and African descent, and 100% of Pima Indians and Pacific Islanders. 12. Even those who are not obese may have a high waist-hip ratio. 12. Dietary factors such as sugar-sweetened drinks is associated with an increased risk. 53. 54. The type of fats in the diet is also important, with saturated fat and trans fats increasing the risk and polyunsaturated and monounsaturated fat decreasing the risk. 52. Eating white rice excessively may increase the risk of diabetes, especially in Chinese and Japanese people. 55. Lack of physical activity may increase the risk of diabetes in some people. 56. Adverse childhood experiences, ACEs, including abuse, neglect, and household difficulties, increase the likelihood of type 2 diabetes later in life by 32%, with neglect having the strongest effect. Prevention. There is no known preventive measure for type 1 diabetes. Though, type 2 diabetes, which accounts for 85–90% of all cases worldwide, can often be prevented or delayed by maintaining a normal body weight, engaging in physical activity, and eating a healthy diet. Though, higher levels of physical activity, more than 90 minutes per day, reduce the risk of diabetes by 28%. As dietary changes known to be effective in helping to prevent diabetes include maintaining a diet rich in whole grains and fiber, and choosing good fats, such as the polyunsaturated fats found in nuts, vegetable oils, and fish. 81. Limiting sugary beverages and eating less red meat and other sources of saturated fat can also help prevent diabetes. 82. Tobacco smoking is also associated with an increased risk of diabetes and its complications, so smoking cessation can be an important preventive measure as well. 82. The relationship between type 2 diabetes and the main modifiable risk factors, excess weight, unhealthy diet, physical inactivity and tobacco use, is similar in all regions of the world. There is growing evidence that the underlying determinants of diabetes are a reflection of the major forces driving social, economic and cultural change, globalization, urbanization, population aging, and the general health policy environment. Management. Diabetes management concentrates on keeping blood sugar levels as close to normal, without causing low blood sugar. This can usually be accomplished with dietary changes, exercise, weight loss, and use of appropriate medications, insulin, oral medications. Learning about the disease and actively participating in the treatment is important, since complications are far less common and less severe in people who have well-managed blood sugar levels. 84, 85. Per the American College of Physicians, the goal of treatment is an A1C level of 7–8%. 86. Attention is also paid to other health problems that may accelerate the negative effects of diabetes. These include smoking, high blood pressure, metabolic syndrome, obesity, and lack of regular exercise. 87. Specialized footwear is widely used to reduce the risk of ulcers in at-risk diabetic feet, although evidence for the efficacy of this remains equivocal. Lifestyle. People with diabetes can benefit from education about the disease and treatment, dietary changes, and exercise, with the goal of keeping both short-term and long-term blood glucose levels within acceptable bounds. In addition, given the associated higher risks of cardiovascular disease, lifestyle modifications are recommended to control blood pressure. 90. Weight loss can prevent progression from prediabetes to diabetes type 2, decrease the risk of cardiovascular disease, or result in a partial remission in people with diabetes. 91. No single dietary pattern is best for all people with diabetes. 93. Healthy dietary patterns, such as the Mediterranean diet, low-carbohydrate diet, or DASH diet are often recommended, although evidence does not support one over the others. 92. According to the ADA, reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia, and for individuals with type 2 diabetes who cannot meet the glycemic targets or where reducing anti-glycemic medications is a priority, Low or very low carbohydrate diets are a viable approach. 92. For overweight people with type 2 diabetes, any diet that achieves weight loss is effective. Medications. Glucose control. Most medications used to treat diabetes act by lowering blood sugar levels through different mechanisms. There is broad consensus that when people with diabetes maintain tight glucose control, keeping the glucose levels in their blood within normal ranges, that they experience fewer complications like kidney problems and eye problems. 95, 96. There is, however, debate as to whether this is appropriate and cost-effective for people later in life where the risk of hypoglycemia may be more significant. 97. There are a number of different classes of anti-diabetic medications. Type 1 diabetes can only be treated with insulin, typically with a combination of regular and NPH insulin, or synthetic insulin analogs. Citation needed. Type 2 diabetes may also be treated with insulin at later stages. Some medications for type 2 diabetes are available by mouth, such as metformin, while others are only available by injection such as GLP-1 agonists. Metformin is generally recommended as a first-line treatment for type 2 diabetes, as there is good evidence that it decreases mortality. 8. It works by decreasing the liver's production of glucose. 98. Several other groups of drugs, mostly given by mouth, may also decrease blood sugar in type 2 diabetes. Blood pressure lowering. Cardiovascular disease is a serious complication associated with diabetes, and many international guidelines recommend blood pressure treatment targets that are lower than 140/90 mmHg for people with diabetes. 100. However, there is only limited evidence regarding what the lower targets should be. A 2016 systematic review found potential harm to treating to targets lower than 140 mmHg, 101, and a subsequent systematic review in 2019 found no evidence of additional benefit from blood pressure lowering to between 130-140 mmHg, although there was an increased risk of adverse events. 2015 American Diabetes Association recommendations are that people with diabetes and albuminuria should receive an inhibitor of the renin-angiotensin system to reduce the risks of progression to end-stage renal disease, cardiovascular events, and death. There is some evidence that angiotensin-converting enzyme inhibitors, ACE, are superior to other inhibitors of the renin-angiotensin system such as angiotensin receptor blockers, ARBs, 104, or Aliskiren in preventing cardiovascular disease. 105. Although a more recent review found similar effects of ACE and ARBs on major cardiovascular and renal outcomes. 106. There is no evidence that combining ACE and ARBs provides additional benefits. Aspirin. The use of aspirin to prevent cardiovascular disease in diabetes is controversial. 103. Aspirin is recommended in people at high risk of cardiovascular disease. However, routine use of aspirin has not been found to improve outcomes in uncomplicated diabetes. 107. 2015 American Diabetes Association recommendations for aspirin use, based on expert consensus or clinical experience, are that low-dose aspirin use is reasonable in adults with diabetes who are at intermediate risk of cardiovascular disease. 10-year cardiovascular disease risk, 5-10%. Surgery. Weight loss surgery in those with obesity and type 2 diabetes is often an effective measure. 17. Many are able to maintain normal blood sugar levels with little or no medications following surgery. 108. And long-term mortality is decreased. 109. There is, however, a short-term mortality risk of less than 1% from the surgery. 110. The body mass index cutoffs for when surgery is appropriate are not yet clear. 109. It is recommended that this option be considered in those who are unable to get both their weight and blood sugar under control. 111. A pancreas transplant is occasionally considered for people with type 1 diabetes who have severe complications of their disease, including end-stage kidney disease requiring kidney transplantation support. In countries using a general practitioner system, such as the United Kingdom, care may take place mainly outside hospitals, with hospital-based specialist care used only in case of complications, difficult blood sugar control, or research projects. In other circumstances, general practitioners and specialists share care in a team approach. Home telehealth support can be an effective management technique.